So long sit, and then the front leg is going to be an external rotation, and then I'm going to go into internal rotation. That's our 90-90 position. Now you'll notice that my torso is moving side to side here, and then that's essentially me compensating to try to get into hip internal and external rotation. So the more vertical my torso is, the less compensation that I'm having in my trunk, which means I'm going to isolate the motion more and more to my hips. We're trying to move relatively slow here, and then you'll notice as I put my hands out, that's going to allow me to kind of work on creating tension throughout my entire system, and actually helps a little bit more with the balance. I don't lean as much from side to side. And then we can also scale it by dropping to an elbow. So it's the exact same hip 90-90 position. Maybe you're someone that has limited hip mobility, flexibility, or you're getting a little bit of irritability in the hips as you're doing it. This is just a simple way for us to kind of scale. And then once you develop the capacity to move into those joints, you can certainly take your hands away. Just a side view, focusing on really accessing hip extension as we kick back behind us. And again, trying to keep my spine relatively neutral and as straight as I can, so that way I'm driving the motion into my hips and not cheating in through my back. And again, we'll talk about scaling in this example to where I'm dropping to an elbow. So this should be a movement that we can go through without having any sort of like pinching pain. If you're getting some pinching pain and discomfort, try to slow the movement down or scale it back a notch, and then kind of come back and try it again, because sometimes it'll help loosen up tissues and you'll be able to isolate it to the hip joint.